Memorial Day, we want to honor not only those who died serving our country, but also those who returned home and are continuing to fight battles of their own with both addiction and mental illness issues. Nearly 5.2 million veterans have a history of mental illness, and less than half that receive mental health support. Dr. Richard Stone joins us this morning. He is a U.S. Army Major General who served as the Deputy Surgeon General of the United States Army and is the executive in charge of Veterans Health Administration during the COVID-19 crisis. Rich, first of all, thank you for joining us. We have talked about veteran mental illness for a long time, but still so many of these veterans do not seek out this help. Is there still a stigma attached to this?
Sure, there's still a stigma. As much as we try to get rid of it, there's still this stigma that we're trained in the military to be self-sufficient, to be able to help everybody else. But sometimes helping ourselves is really difficult. And you know, there's 18 million veterans in America. About 70% of us have combat experience. I was the first combat experienced veteran to actually lead the VA's healthcare system through the pandemic. And I'll tell you, it's tough to ask for help sometimes.
Has there been a mindset change, though? You know, veterans are trained in some basic first aid, how to tourniquet, how to do things. Is mental health something now that is starting to be included in that conversation, helping yourself and getting the help you need?
I think it is, and I think it's about the cohesiveness of veterans coming together with each other and helping each other. If I have any message for your viewers that's most important today, is reach out to a veteran you know and just tell them you're thinking about them.
You wrote a book here. Let me show this for you. It's called Save Every Life You Can. We're losing veterans because of the fact that they are not able to access the care that they need. How do you get them that care?
Well, first of all, by others reaching out to them and saying they need help. But you can also go to a veterans center. You can call 988, which is the new crisis line number that came about a year ago to make it easier to call. You 988 and you push 1 and you get a trained crisis counselor who's trained in veteran issues.
If someone has a veteran that is struggling with these issues, how do you start this conversation? Is it sometimes good to maybe get another veteran to come into the conversation, someone they see as a military peer? How do you start that talk?
Look, you grew up in a military family.
I did.
You know that it's hard for us to talk sometimes. I think other veterans reaching out is always helpful, but any American who's concerned, any friend that's concerned, should reach out and talk to the veteran and make sure they know that you're concerned about them, you're thinking about them, that today on Memorial Day, on Veterans Day in November, you want every day for them to know they're part of a community.
Why don't you hold the book up one more time here? It is Save Every Life You Can by Dr. Richard Stone. This is really important because even though maybe the combat battles that these veterans face may have ended, they face an even bigger battle sometimes, you know, dealing with these issues and accessing the care they need. So this is a very important thing, and obviously if you need to have this conversation with somebody, this is a good resource to start. We thank you so much for your service.
Tom, thank you so much for what you do every day.
And telling us about this. All right, Maureen, we'll send it back over to you.
Thank you, gentlemen. Still ahead is a name change in the